Hi, I'm Kamel Fisher, and we are at the 14th edition of the LD Micro Conference here in Bel Air. And with me, I have CEO of Bright Minds Biosciences, Inc., with the NASDAQ ticker DRUG. Ian McDonald, hi, welcome.
Thanks for having me.
Very, very good. We are so excited to hear more about, Bright Minds Bio and what it is that you guys get up to. So please give us a brief overview and tell us what we can expect.
So Bright Minds Biosciences is a biotechnology company. We are a Canadian company just about to list on NASDAQ. We focus on creating next generation serotonergic drugs. So these are drugs meant primarily for mental health conditions, but also some neurology conditions such as epilepsy and chronic pain.
Wonderful. Of course, we're all kind of coming out of the global pandemic. How did that affect your business and really the entire medical ecosystem as you understand it?
Well, it definitely affected the patients that we're looking to treat, I think, more than anything. So I don't think it's news to anyone to say that mental health conditions have been extremely exacerbated by what we saw in the last 18 months. That goes for depression, that goes for opioid use disorder, as well as Alzheimer's disease psychosis, and the way that some of those patients are having to interact in long-term care facilities or even in a more constrained environment in a home that has more people under that roof for more hours in the day. So really just across the board, those patients have had a very difficult year, a very difficult 18 months, and that's something that we're very happy to be working on.
100%. And that leads me into, questioning the solutions that the development of this next generation therapeutics will offer to everyone concerned.
Yeah, so our drugs are really looking to target, let's take depression, for example.
Right.
You have your standard therapies today, SSRIs. These are medications like Prozac. And while those medications work for some of the population, it's typically the ones who are mild to moderate in terms of their severity of their conditions. What our medications and more broadly the psychedelic class look to treat are the more difficult, the more severely affected depression patients. These are people with depression so bad that they are thinking about taking their own lives. They're unable to get out of the bed. Those are the people that can really see the most benefit from our drugs.
Great. So I'm curious about your business background firstly, and of course why this intense interest in brain health.
Yeah, so I started off my career working in investment banking. I was there for a number of years, primarily matching capital with ideas and working on some strategic initiatives, mergers and acquisitions, that sort of thing. So I started getting interested in the serotonergic field, and more specifically in the psychedelic mechanism around 2014, 2015. And the more work I did, the more evident it became that these drugs aren't perfect. There's a lot of room for improvement, and that team capable of doing that hadn't yet been assembled. So I took my background, which is really finding the talent and making sure that talent has the financial capabilities to go really do what they're good at, which is create new drugs and innovate.
Right, so recently there was mention of success with preliminary trials and that there's a potential rollout with human trials in 2022. Our interest is how do you plan to have this first human trial roll out, and what age group will you be targeting?
So for our phase 1 clinical trial, we will be in clinic early next year. That clinical trial will be a SAD-MAD, single ascending dose, multiple ascending dose trial in healthy human volunteers. we will be then, once we have that information in hand, we will then be targeting diseased individuals. And these will be adolescents for Dravet syndrome, which is a rare childhood form of epilepsy. We will also be running a second proof of concept trial for sort of at the opposite end of the spectrum in terms of phase of life with Alzheimer's disease psychosis. So those are two clinical trials we are running next year. They won't be the only clinical trials. We'll also be running a phase 1 clinical trial for our psychedelic drug program that will be followed on with a proof of concept trial for depression.
Great. You guys have a very unique portfolio of medicines, right? Do you want to touch and just clarify any particular one or few?
Yeah, so we have, like you just mentioned, we are not a one-trick pony. We have a whole pipeline of serotonergic medicines. Those different medicines are targeted to specific patient populations. So one for Dravet, another drug could be positioned for depression, and really a breadth of compounds that we're creating to precisely treat abnormalities in brain circuit and serotonin levels. So we'll also be looking at potentially treating chronic pain conditions such as chemotherapy-induced neuropathy or cluster headache. There's a very, very long list of potential applications for our drugs.
100%, but all very worthwhile, right? So, there's a lot going on. We've had the COVID pandemic. You guys are working on really unique and specific solutions. What are the biggest challenges facing you and your progress?
I would say the biggest challenges facing us would be an ongoing, I would say, looming threat of additional lockdowns, which could affect clinical trials.
Right.
That would be the biggest unknown. Other than that, there are always things that can pop up in drug discovery. This isn't a straightforward business. It really is until it isn't. So we've done our best to mitigate all of the potential risks. We believe we've done an excellent job in that, but that's not to say that it's a completely riskless endeavor. So the fear would be the unknown.
Great. If there's any takeaways you want to leave your investors with as you're uplisting very soon, what is it? What do you want them to know and keep in mind as you embark on your journey into the NASDAQ or listed world?
We're very excited to go on to a senior U.S. exchange. NASDAQ is really the home of biotech investors. And we've seen to date a pretty major discrepancy in terms of valuation between our stock and our peers. We believe that our pipeline, our team, rivals and in many cases exceeds those of our peers. However, that really hasn't been reflected in our share price to date. And that's largely a fact of the exchange we're trading on. The investors that are interested in biotechnology and understand what we're doing are now only given the opportunity to invest in our stock. And with that, we believe that we have a very catalyst-rich 18 months that will really be rewarded with the investor interest and appetite now that we're listed or will be listed on senior U.S. exchange.
Awesome. And so definitely a standing client of Sequire's, and of course we're very happy to have you. How do you foresee our platform assisting you with your IR strategies?
The insights that Sequire can give are really second to none in terms of identifying which shareholders of ours are interested in the story, which potentially need more attention, and identifying where we can focus our attention in order to maximize our IR efforts.
Exactly. And with that, mentioning the story, but getting the story out, with our very specific media targeting. But nonetheless, another conversation for us to jump into another day. What do you want to, again, leave investors with as a takeaway to keep in mind as we close off?
We are entering a very interesting time in Brightmind's life cycle with our entry into clinical trials. That entry into clinical trials comes with a number of pivotal milestones, which should be indicative of value inflection. So, and a great time to be a Brightmind shareholder, and stay tuned.
Awesome. If anybody wants to find out a little bit more, where can they find more information?
Check out our website, brightmindsbio.com, and feel free to reach out. We are happy to chat and give you any additional information that isn't available on our website.
Great stuff. Again, I'm Kamal Fisher. I've been sitting here with Ian McDonald from Bright Minds Biosciences, Inc., with the ticker soon to be NASDAQ DRUG drug.